feedback, other exam, I mean, those who has noted and observed.
Dr. Aaron, you asked especially you were differentiate, you were asking for herpetic or also impetigo, that only this outer surface, no? Eye examination, especially for herpetic, no?
Yes,
So
yes. For herpes.
okay.
You did good. Any other comments, other feedback? Otherwise, we'll move to another one.
I would like to respond to a question in which you ask it is localized or generalized. Was it generalized?
It was generalized, yeah, because I showed him two lesion. Localized means only one point, like face or any hand or any leg. But here it was like I showed two picture, one on the face, one on the legs. So it became generalized.
What I remember, I'm not sure, we can recheck it, that if there is involvement of the other system other than the skin, like if there is nephritic syndrome, or if there is involvement of the kidney, which is very common with impetigo, especially the skin lesion other than the nose and this. So in that case, we call it generalized. Or if there is other infection, like if there is pneumonia, if there is osteomyelitis, yani other system than skin.
Yeah, that is true. That is true. But what I mean, video, image, we can show this generalized by showing like two side. If I show only one picture of like only face, and if I don't give anything other than, it is most likely it's a localized, to be assumed as a localized. You got my point. I gave him a clue. In fact, he asked also for osteomyelitis, for the pneumonia, for the throat and all. That is the reason I think Dr. Jaiprakash, he asked for all as an additional history. Am I right?
Yes.
But in a picture, if you want to show generalize, you show like 2 or 3 site of impetigo, right?
Can I ask few questions from the candidate?
Sure.
Yes.
There was a question that how you evaluate this, yani how you will investigate that this is impetigo or not. So how you will proceed?
To be honest, the presentation, as far presentation, that is as clear vivid from the picture, that is this honey colored lesions that goes in the favors of that is. Apart from that, we will document it, this swab culture from the local site.
Yes, very good.
Yes.
Now, if it is vesicular, then because there are two types, one is the vesicular type, yani bullous type, and one is the non-bullous type. So let's suppose it is a bullous type, so you cannot take a swab. Then what you will do?
In that case, the blood culture will tell that.
So I think I already got the prescription.
Something better than blood culture.
You just give the same prescription.
Yeah, you will rupture the bullae, and then you will the honey color fluid which will come out. You will take swabs like that. Yes. Is there any other investigations we can do?
Other than inflammatory, these markers, they are the supporting, but it is as you told this
and ask them to come after 2 days.
Can someone please block the mics? Yeah, there are very good investigations. When you said the swab, then you said the blood culture. There are a test which is known as a streptozyme test. It's very specific, especially for the one having the skin involvement, extensive skin involvement. You can do that streptozyme test. It will be positive. And nowadays, the difficult, this is just a discussion. What I know, I am just sharing with you guys.
That is from local. That is, you are telling that test. That is to be carried out.
Sorry?
That test is to be carried out by
Yes.
this or from the local side or from this blood.
No. It's a blood test. It's just like ASO titer. You know, there is an ASO titer and then there is a streptozyme test. The ASO titer. Yeah, the ASO titer, it can be raised because it is a group A beta hemolytic streptococcus. It can be caused by this. And one good question can be, what are the organisms which causes this? It is also a very good question. So group A beta hemolytic streptococcus, Staph aureus, group A beta hemolytic Staph aureus, and the MRSA, methicillin resistant Staph aureus. They all can cause. And there is one other, the Streptococcus pyogenes, I think, but you need to confirm this. So mainly it is Staph aureus, but Streptococcus can also be involved. So the ASO titer, it will give you only the Streptococcus variety. The other thing will be picked up by the streptozyme test. There can be another test which is anti-hyaluronidase test, which is a part of streptozyme test. And it will almost 80 to 90% of the organism will be picked up by this test. Nowadays, the most important is the MRSA, which is basically a community acquired, and it has a very poor prognosis, and it is especially in those children which are immunocompromised or who has a contact with someone who is positive. So this one is important. Other thing regarding the antibiotics you guys discussed, he asked you a question regarding the IV antibiotics and the oral. So the IV is, because the age is more than 8 years, so you can give clindamycin. It's a very good drug. And oral, because age is more than 8 years for this child, so the oral you can give is the doxycycline. It's a very good drug for oral. You might be having a lot of other drugs as well.
If they are mentioning flucloxacillin. I just like to interrupt here. They are saying flucloxacillin. I mean, I agree with you, clindamycin option. But instead of doxy, they are saying flucloxacillin. I don't know whether to suggest doxy is correct or not. Hello.
Yes, Dr. Aaron.
Yeah.
What about this? Now, this areas I left this permit. According to the permit, you comment, please.
Yeah, they are mentioning flucloxacillin and clindamycin. I agree
but
with
if you are having MRSA,
your voice is breaking. Hello.
Dr. Tahir is not audible. Might be some network problem with him. But
yeah. So I'm sorry. Just there was some problem in the connection. Just got back. Yeah. Sorry.
Yeah.
So did anybody note areas according to the permit? Please.
Yeah, I asked you all question according to the format only.
Yeah. No, but any of this further the flaws or any this drawback?
Yeah, anybody else has a feedback for Dr. Jaiprakash? If no feedback, so 6 days. 6 days.
6 days, yeah.
6 days, and he refusal to feed and this rash. And also, mom noticed there was a temperature also. In the night, there was a mild fever, and child is not taking the feeding. This is the stem.
Mhm.
Take your time, and once you are done, you present.
Okay,
Other
we can
other
start.
people, sorry, okay, other people just just follow that pattern which I send in the group, and just to see where she stands. Okay, we can start. Who is keeping the time? Dr. Jayaprakash, can you keep the time?
I will do,
Okay.
no problem. 6 minutes. No, Dr. Jayaprakash do
Okay.
it.
Okay.
6
Okay.
minutes from starting.
Okay, so start your presentation.
Yeah, this 6 days old baby have rounded ulcerated areas on the trunk and the hand. I think the right hand, but most of the hand is covered. But under this cover, there is ulcerated area. There is no signs of infection on it. It's raw area only. Um, I cannot say from the picture I saw that there is um, no mottling of the skin, no other associations, no devices attached to the baby.
Okay.
Yeah. So according to the opening statement and the picture given, I think this baby have uh, could be Staphylococcus with skin syndrome, or maybe other like epidermolysis bullosa. Um, could be I cannot say. Maybe a toxic shock syndrome, but it's not common in that age. It's going with Staphylococcus skin syndrome mostly.
Okay. Okay. So, what additional history would you like to obtain?
Uh, yeah, the mother said there is a fever and this skin changes from how long it started.
Okay. What else you would like to ask?
And
Mhm.
if there any change of the skin lesion, it was before any vesicles and then ruptured and become changed, give this skin lesion after that. Um, the mother said that there is poor feeding. What's about the other activities? The crying of the baby, his pee and poo, how many nappies are changed per day.
Hmm.
Yeah,
Okay.
the mother is yeah. Before I want to ask the mother also if she has any problem during pregnancy or any stormy labor. If she's screened for group B, group A beta hemolytic strips before labor, or having a baby before who has infection with group A beta hemolytic streptococci.
Okay. And what additional clinical examination you would like to perform?
I have to examine the baby thoroughly from head to toe. like neonatal reflexes. I have to examine his eyes, the conjunctiva, and the mucous membrane, his mouth, if there is any ulcerations, the perineal area. I have to search for any organomegaly. Also, I have to examine the chest, and if there is any hard sounds, if any murmur, and any audible adventitious sounds over while I'm just doing a chest examination. For
Okay.
yeah, for sure, I have to start with his vitals. For sure, his
Yeah.
saturation, blood pressure, and the check temperature again, and check the capillary filling time, and the peripheral perfusion if it's cold, metal, like that.
Right. Okay. So what investigation would you like to perform?
I have to do, run some basic investigations like CBC with differential, CRP, um, I, and for sure, if the baby is feverish, I have to take blood culture. Okay. Um, if there is any central nervous system affection, I have to discuss taking a sample from CSF with my consultant for analysis. Doing chest X-ray, because you told me that the fever reached up to 39, so I have to exclude any chest infection. Yeah,
Right.
and yeah. And if there any oozing from these skin lesions, I'd like to take a swab, skin swab.
Okay. So um, how you would differentiate this condition from
Okay. For the toxic from toxic epidermolysis necrolysis bullosa, um, I think that the area is more extensive. More than that, there is mucous membrane affection. And yeah, also the condition looks toxic. Can presented with shock, septic shock.
Right.
Yeah.
Right. And what particular history you will notice into that
With 10,
in 10?
um, actually, I don't know, but they seem like a poor general condition. Yeah, from the mother, what is the history? I would like to ask.
The history of a drug, right? Generally, any drug induced. So, any prior ingestion of the antibiotic or any anticonvulsant or like that.
I don't think, yeah,
Time finish. Okay.
in that age, I don't think that 6 days old. This 10 or Stephen Johnson in, I think in infant or the children taking any medication like antibiotic, anti-epileptic medication, anti-epileptic drugs, and this is the side effect of it. I don't think that it will be presented at that age, small age.
Yeah, no, but I'm just asking you, like how this is the history will tell through that history you would differentiate this 10 versus Staphylococcus aureus because 10 Stevenson Johnson they have a history of the drug ingestion.
Yeah, yeah, yeah.
Okay, so from my side, you identified sign which were present. You correctly interpret the sign and you give the formulate the appropriate differential diagnosis also and only something which you like regarding implication you ask for the murmur and additional heart sounds and all, which is okay, but the moreover like general activity, reflexes, general sensorium, and the respiratory and the other skin areas, that is more specific rather than the heart. But if you tell me about perfusion, 100% it is nice rather than the additional heart sound and murmurs here. Scapulary refilling is more relevant in cardiovascular rather than the murmur and all this. So it was good. Other feedback from the other people. So you did very well. Others feedback, please.
So here the differential diagnoses are two only: the staphylococcus scaled syndrome and another is this epidermal bullosa. No.
Yeah. Yeah, I put epidermolysis bullosa and staphylococcus skin syndrome. And Dr. Heron also added that there is a possibility, but the older age of 10. Yeah. If there is mucous membrane affection also.
Mhm.
Any other feedback? Sandeep, Dr. Tahir, Dr. Iman, Dr. Tamanna.
No.
Yeah, actually, I had some internet issues. That's why I really joined a bit late, and I could not hear the stem actually. But I just heard the discussion between you guys. It was good. It was smooth. But to me, it looks. I don't know about the stem, but to me, it looks more like epidermolysis bullosa, because if you zoom it and if you look at the hands, uh, there is some lesion on the hands as well. Um, Anyhow, the examiner knows better because he took it from somewhere and
No, it
depends
was,
upon the
I mean,
stem.
it's a very close related these things. But I took a picture of staphylococcal scalded syndrome. That's why in the stem I gave the fever and refusal to feed and all. Okay. Any other feedback?